Hello, everybody. I'm going to try to keep my part in this bit brief. My name is Christian von Kramen. I am the Experiences Coordinator here at the Aquatarium. We are thrilled to be able to welcome MEDtalks once again to our facility. The Aquatarium is a not-for-profit charity whose mission is to inspire curiosity through enriching and entertaining experiences. We hope that through MEDtalks you all get to experience some of that curiosity today. We would like to thank the Brockville District and District Hospital Foundation and the Brockville General Hospital for their very important partnership in being able to run this event. I would now like to bring up Trish Biot, who is the Executive Director of the Brockville and District Hospital Foundation. Trish has a long history of working with charitable organizations and is very passionate about our community and specifically about healthcare in our community. Please welcome Trish.
Thanks, Christian. We really do appreciate the Aquatarium. Can you hear me back there? Yeah? Okay. We do appreciate your partnership, and it's such a great venue, and I'd heard tonight that some folks hadn't been here before, so enjoy it because it's wonderful. Lots of fish behind here if you haven't seen it, but anyways, we really appreciate it, so thank you. So I want to welcome you to our third MEDtalks. And this one is on smart moves for a safe summer. So any questions you might have, we've given you little cue cards. We will have a microphone if you want to ask them in person. I mean, stand up when we have a Q&A. We're doing a little fireside chat. But if not, you can write it on your cue cards, and you can give us the cue cards, and we'll ask the questions on your behalf. So please, think about it when you're going through. And again, no question is big or small. We've got quite a panel here today to answer your questions. A little bit of housekeeping. The bathrooms, just so you know, are around the back of the Lighthouse Theatre here. And so if you need to go, just when you walk down, just be careful with, and hold on to the railings. The session is being recorded. So when you ask your questions, we'll ask you to use the microphone because we do post it on our website. I'm not going to say that you won't get videoed, but there's a potential you will, but I just wanted to make sure you knew that. Okay, so again, if this is your first MEDtalks, welcome. We're very excited about this. It's starting to catch on, and we're starting to get more people that are interested, and we really are interested in hearing from you on the topics that you want to hear. We've got lots of great folks in our community who can talk about your healthcare and support your healthcare efforts. Of course, the hospital, we've got an amazing group of physicians and healthcare workers there. So whatever subject makes sense for you. We did talking about colon care last time, and we did talk about the Emerge. We might do that again. Now it's a little safer. It was a little tenuous at the time, but we dove right in and we answered people's questions, which was great. So these sessions, again, are really educational. They're to really give you some background, ask some questions, and really it's about prevention. So again, no questions, big or small. So we also demystify kind of the healthcare system for you. So again, if you have questions, please don't hesitate to ask. Now I'd like to introduce Julie Caffin, who's the President and CEO of Brockville General Hospital. Julie's worked tirelessly at Brockville General for more than 8 years now, right? Okay. And has a long history at Kingston General Hospital, and emergency medicine and chief nursing officer. So she has lots of information to share as well. So I'm going to hand it over to Julie.
Thanks, Trish. So excited to be here, and thank you for joining. Very timely topic now that the weather seems to be cooperating with us, so it truly does feel like summer. So we're hoping that this session gives you some tips on how to stay safe. We have a great panel of experts with us tonight. So we have Dr. Lena Lee from the Southeast Health Unit, Caitlin, who said I didn't have to say her last name, but she'll tell you what it is when she comes up here. She's from the Ontario SPCA and Humane Society of Leeds and Grenville. Jeff Kars is from Leeds Grenville Paramedic Service, and Kevin Richards and Leslie Groves from Brockville PharmaSafe. So I can give you a little bio on each of our panel experts. So Dr. Lena Lee is the Deputy Medical Officer of Health at the Southeast Health Unit. She completed her residency in family medicine and public health and preventative medicine at Queen's University and holds a master's in public health from Johns Hopkins University. Caitlin is the Community Outreach Coordinator for Ontario SPCA and Humane Society Leeds in Grenville. Her role in the community includes pet food distribution, event and fundraising management, and education for both youth and adults. Jeff Cars is a dedicated and experienced leader in pre-hospital care, serving as the paramedic chief for Leeds Grenville Paramedic Service. With a career spanning over 3 decades in the field of paramedicine, Jeff brings a wealth of expertise in clinical excellence, operational management, and strategic planning. He's known for his commitment to community health and safety and has been instrumental in implementing innovative programs that enhance patient care and improve hospital care provided in the field. A collaborative and compassionate leader, Jeff prioritizes professional development within his team, fostering a culture of resilience and continuous improvement. Kevin Richards grew up in Maitland and is a proud graduate of the Brockville Collegiate Institute, class of 2013. His academic journey took him to Western and Queen's universities, where he earned degrees in life sciences and anatomy. After his studies, Kevin spent 2 years in Halifax, contributing to research at a children's hospital, an experience that further fueled his passion for healthcare. He is currently pursuing his pharmacy degree in Toronto. And Leslie Groves is the pharmacy manager at Brockville PharmaSave with over 31 years experience as a community pharmacist in Brockville. She is currently mentoring Kevin as he works to attain his degree in pharmacy. And this is Leslie's second time joining us, so welcome. So with that, I am going to hand over to Dr. Lee to kick us off.
Thank you, Julie. And everyone can hear me. Oh, louder. Okay. Deal. I can be louder. I have a certain amount of time, so I'm timing myself. So I am talking about a few things today, with a focus, I think, on animal encounters, and then we'll talk about travel health, and then some sort of other things that I thought was critical to talk about for the summer, even though they're not necessarily, they're one-liners that didn't really fit anywhere else. So in terms of animal encounters, really, I think the reason we're talking about it now is because the summertime is when people have the most what we call animal encounters. So at the Health Unit, really what that means is people have been bitten or scratched by a dog, or an animal. The most frequent animal is a dog, but oftentimes cats, bats, raccoons, ferrets, whatever the case may be. And the role of the Health Unit really is primarily around rabies control. So I'll talk quite a bit about rabies control as well. But I wanted actually to first start up by talking about cleaning animal droppings and then a little bit about birds. So in terms of cleaning animal droppings, because we get inquiries not infrequently at the Health Unit about this, just a few quick notes. One is the concern about animal droppings is really contamination of the hands, or else aerosolizing the animal droppings and then breathing it in. And really, it's the second one that has the greatest health risk. And so we very, very, very highly recommend to not use spray bottles or anything that will spray up those animal dropping bits and pieces into the air for you to breathe in. And also really critically, and I put this in mainly because we heard about this, is not to use a leaf blower. So not to use things that are going to be blowing things up into the air, and then there you are breathing it in. And so those I think are the main things to do with animal droppings. And then the last, I think, is probably a little bit of common sense, but just worth noting, is washing your hands, right? So washing your hands after you've done any sort of cleaning in and around the house that may put you in contact with animal stuff, animal droppings, or what have you. that was the quick one. The bird piece, I wanted to spend a little bit of time talking about H5N1, also called avian influenza or bird flu. So that's something that you may have heard about in the news. It is a strain of flu or influenza that is circulating primarily among birds. Human cases are very rare, but there have been human cases, and where there have been human cases, they oftentimes have been severe. And so that's why it's of concern for the health unit and also I think in the news. Having said that, I think, well, first of all, we do have H5N1 among birds in our region. We have had those reported to us sort of rarely, but we know that birds are flying as they migrate. They fly in all sorts of places, including to our region, right? And so there certainly is a risk of exposure. Having said that, the risk for humans exposure is exceedingly small, and that's because you really have to be in very close contact with a bird in order to have that substantial risk of avian influenza transmission. So usually it's, for example, vets, people who work with, for example, wildlife rehab. If people are encountering birds out in the wild, what I'll say is not to approach birds very closely, not to approach injured or dead birds. If you do find an injured or dead bird, the place to call is actually the Canadian Wildlife Health Cooperative. They'll have more information for you. But otherwise, the risk in general for people is quite low. Some people do have backyard chickens though, and there is a risk of transmission from wild birds to one's backyard chicken flock. And so, does anyone have backyard chickens here? I might just pass my section on that then to get on to other things. So, the main thing to talk about then is rabies. So, rabies is a virus that can be transmitted from a mammal. So rabies, the virus itself is only able to live in mammals, not in other types of non-mammal animals. Humans are mammals as well, and so we're certainly at risk. The risk of rabies is that an animal that is carrying the virus usually it's biting because it's in the saliva of the animal, and then if they've bitten you, then it can get into your nerve, and then after you've sort of had that exposure, then the rabies virus will sort of transmit up the nerve into the central nervous system. And so the time between when you get the exposure to when it reaches the central nervous system, typically people don't have symptoms. Once it reaches the central nervous system, then the virus is very dangerous and almost universally fatal. The risk of rabies in our region is very low. We do have, and I'll get into some of the sort of epidemiology, but I wanted to say as well that the time between rabies exposure and the rabies infection, which is when you develop disease, is in the range of 2 to 3 months. And so sometimes people wonder, well, I got this bite, do I need to seek medical attention right away? We're talking about, probably within the day or sort of 24 hours to seek medical attention gives you lots of time. It's, I wouldn't wait several days before you seek medical attention, but the incubation period is 2 to 3 months, and then sometimes as long as several years. In Ontario, all quote owned cats, dogs, and ferrets, so like ones who are pets, whether inside or outside pets, are actually required by law to have to be up to date for rabies vaccine. I think that's probably not news to people. Most pet owners are aware of that requirement. oftentimes there's no sort of registry or anywhere to sort of find out if a pet is up to date, except if there's actually an exposure and there's a risk of rabies, right? So there's a few things to mention about pets. One is that if you have an indoor pet, really there is no substantial risk of rabies for an indoor pet that never goes outside. If there are sort of mixed indoor or outdoor, if there's, for example, dogs often go out on walks, are going outside, then really they need to be in contact with an animal that has rabies in order for themselves to have rabies. So oftentimes at the health unit we get calls about rabies exposure, and there is a risk assessment involved. So yes, we are, sorry, I forgot to check about the slides, so thank you for keeping up. Oh yeah, they are, thank you. So there's a few things to mention here. Some of them are on their slides. So of course, reading the body language of dogs that you come across, not going to pet it right away, but checking with the owner that it's okay to interact with that dog. I think at the health unit, the most common animal exposure that we get is a dog bite. And so I'm often surprised at how many dog bites are possible to have in one community alone. And in any given day, like 24 hours, sometimes we might have none, sometimes we might have 3 or 4 dog or animal exposures, mostly dogs. And so it really is quite frequent, and oftentimes it's because it's a dog that you've come across sort of out walking, not typically people's own dogs, right? Or a dog at a friend's house. It's really sort of out and about, and a lot of these can be avoided with sort of good pet interaction etiquette. So reading body language, especially for kids, oftentimes kids don't realize that not all dogs are going to be comfortable with being petted or people being in their personal space. And then for wild animals, not approaching wild animals, especially ones that look unwell. I think oftentimes people want to help out a wild animal that's looking unwell, but even if it doesn't have rabies, oftentimes it may be injured and more prone to biting or scratching as a result of discomfort or fear. Bats are the highest risk of rabies. So I mentioned I would come back to this. So in Ontario, or in this region of Ontario, the only animals that consistently are a risk of rabies are bats, actually. So we rarely have domestic animals that are carrying rabies, but bats can carry rabies and also travel some distance, and also can inadvertently get into people's houses, for example, and then that's where the exposure happens. If you have, so next slide, if you have some sort of exposure to an animal, mostly it's biting. For bats, it may be biting, or if they land on you, or if they scratch you. The most important thing that you can do is actually wash that wound for 15 minutes. And the reason is because actually the absolute risk of rabies is very low, but bats carry, well, other animals carry bacteria oftentimes in their saliva that are a risk for some sort of wound infection for humans. And actually your own skin has bacteria on it as well. That's a risk of infection. And so statistically, the highest risk thing to your health from a bite or a scratch or an animal encounter is actually a bacterial infection, or just a wound, right? Like you've gotten a bite, it's bleeding, it's open, like those sorts of things. And so washing the wound is the most important thing that people can do for an animal encounter. The next thing to do, of course, unsurprisingly maybe, is to contact the health unit. So we can help you with a risk assessment to see whether you do have a risk of exposure to rabies and whether you do need some sort of intervention. maybe not, right? Like, not all animal exposures do need a rabies vaccine. Again, most animal exposures are with pet dogs, and most dogs are up to date for their rabies vaccine or are very, very low risk for having had rabies. And most of the time we can actually observe the pet animals to see if they develop any symptoms within a 10 to 14 day window, and you don't actually need any intervention yourself. And that sort of thing we can work through with you at the health unit. So if we go to the next slide, the next thing I want to talk about, which I think is relatively brief, is travel health considerations. So I'll just say as a caveat that travel health is not a core part of public health, and so I'm not the expert. Certainly travel clinics will have much more expertise than the health unit, but there are a few things that I want to mention. One is, I can look over here, vaccine preventable diseases. So the big take home for me on this section is please go see a travel clinic at least 6 weeks ahead of a trip, especially an international trip, because oftentimes the vaccines that you need, if you need one or several, may be a series, right? So you may need 2 or 3 doses, and to do it sort of 2 days before your trip doesn't give you the level of protection that you might expect out of a travel vaccine. There are many travel-related vaccines, and a travel clinic can give you advice on that. Statistically, the thing that is the greatest health issue that people develop as a traveler is diarrhea. So oftentimes it actually has to do with traveler's diarrhea, which is a type of bacteria that locals are already immune to, but a traveler is not. And so the water is safe for human consumption, but you as a traveler may actually have a little bit of trouble with that water. And traveler's diarrhea is typically not serious, but it can be a pain as a traveler to experience. And certainly there are ways to prevent that as well. And then the other thing to mention about diarrhea is having good sort of making wise choices around food when you're traveling is really important. So boil, the line is boil it, cook it, peel it, or leave it in terms of travel food. And then, keep on looking. Yes. I won't go through some of these other ones, but to say under other considerations, hand washing, right? Washing your hands, common things are common. The single most effective thing that you can do to prevent infection wherever you are in the world is to wash your hands frequently before you touch your face and before you eat. And then also safety and injury prevention. So having the right protective gear, having sunscreen, reapplying sunscreen, all of those things. Again, common things are common. You're going to have the same experience sort of no matter where you are in the world. It's just that it's sometimes harder to remember when you're traveling. So then the next slide is, okay. The next slide was removed, sorry. So it's really just some quick parting thoughts that didn't fit elsewhere. One is in the summer, if you're on a well in your home for your drinking water, remember to test your well water at least once a year for bacteria, and more frequently if you've had a flood or some other thing that affects your well, to prevent GI illness. And then the other thing is we are having air quality concerns every once in a while because of wildfires, and so keeping an eye on air quality and rethinking sort of your plan for the day, whether you were going to be outdoors, if there are air quality alerts, especially if you have sort of chronic heart or lung conditions, is something to keep an eye on right now in the summer. All right, thank you.
Okay, hello everyone. Everyone can hear me? This is a good volume? Perfect. So my name is Caitlin, and I work for the Ontario SPCA and Humane Society here in Brockville. So our animal center is located here in Brockville, but we cover all of Leeds and Grenville. So if you are here today, you likely are in the Leeds and Grenville area, and therefore we are your closest animal center. We have 12 others in the province that cover our other regions, but we are your closest, most local resource. So today I am going to be talking about specifically looking at annual checkups and how that relates to tick health with our furry friends, and then going into heat safety. This Friday, the Ontario SPCA is launching our annual No Hot Pets campaign. We run that every summer, and it's in regards to making sure that pets are safe when it comes to vehicle safety in the heat, as well as I'll just touch on some other basic heat and caution topics in regards to our pets at home. So starting off with our preventative wellness checkups, you will see not only us, but a lot of the local veterinary offices mention the importance of having your annual checkup with your pets around the spring or early summer. And one of the key reasons for that is, one, to ensure their overall health as well, but also make sure they are up to date on their vaccines, one of which being rabies, and then that they have had their weight accurately done and their wellness approved for their flea and tick medication. So if you have animals at home, you likely have heard of flea and tick medication before, and one of the main pieces to it is that it keeps the disease transmission from happening when a tick bites your animal. So it's not necessarily going to prevent your animals being bitten by a tick, but it helps in that disease transmission process. And that is in very basic terms. I do not know all the science behind it, but that is the overall take-home message of it, of why it is important, why it is recommended by your local veterinary offices, etc. So that flea and tick medication is one of the important pieces. But there are also other things that we can do in our homes to make sure that not only our animals, but also ourselves are safe when we're looking at tick protection. So, of course, the medication, your flea and tick medication, sometimes it can be an edible treat. Lots of dogs don't even know they're taking it. It's like a great little treat they get to have when they come home from the vet. Others will have a topical cream that usually goes in between their shoulder blades, which is one that you're just squeezing on. Both have similar results in how they prevent your animals from Lyme's disease. When we go into more of actionable beyond medication preventative measures, we're looking at maybe avoiding certain walks, certain places, certain parks when it comes to those peaks in the year. So if you're looking at spring and fall, where we tend to see those peaks in our tick populations, so maybe you're doing more of an enrichment at home, you're doing more exercise in your yards at home, you're minimizing your time out in those kind of more wooded, forested trails potentially. We know Brockville, we have lots of those. They're great walking trails, but maybe not the best to be on with your animals in those peaks of the year. You also want to manage your own yard, so ensuring that tall grass, any sort of like bush and tree line, that if you have the ability, if you have kind of like a fence that can be moved, maybe you're bringing in your perimeter a bit. There's only so much we can do. You can't go out and cut down all your trees and bushes when the peaks of the year in your backyard. That's understood, but it's doing what we can to manage even our own yards at home to limit that risk. When it comes to checking your animal for ticks, some fun little tricks that people have found work for short-haired animals. Lint rollers are really great to do when they're coming in and out from using the washroom. So those kind of in and outs are happening all throughout the day, and it's not very practical to sit down with your animal, comb through them, maybe have someone else help you do a full detailed check. As much as that would be amazing to do, it's not practical. And so whether it's a lint roller or for some longer haired animals, a microfiber cloth or mitt, there are also tick mitts that are sold online as well. All of those tools are great little tricks to ease the detailed checkups that we may do after a longer walk or more time exposed where there may be more tick exposure. With those longer tick checks with your pets, sometimes it helps to have some food motivation for them, maybe another helping hand to hold them. It's just like a human. Those ticks are looking for the cozy nooks and crannies, so under their ears, under their legs, all of those kind of hiding spots you want to be looking for. Taking a bit of extra time on any of your animals that have darker fur. It can be very difficult to find them, and therefore it's important to take your time, especially, like I said, after those bigger walks outside. In terms of removal tools, a lot of the veterinary offices will have them available. the little animal, like for your pets at home, tick removers are a great resource for your furry friends. They are an effective removal tool. They tend to be quite easy, kind of foolproof, and it's important to know where that is kind of at all times, so it's an easy resource to reach for when you need it. The biggest take home with preventative, anything preventative in regards to ticks in your animals is you're not just protecting their health, but you're also protecting your own. They get to take that yummy treat, they get that little topical cream. We don't necessarily have that, and if that tick is not happy on your animal, they're going to hitch a ride maybe on your pillow or on your couch or somewhere else in your home, and you're therefore at risk of that tick making its way to you. And so our furry friends, as much as we love them, can bring in unwanted friends to our homes. So therefore it is important that we are doing those checks, not only for the safety of them, but for the safety of us. So on our next slide, in regards to heat and animal care, it is not just vehicles where heat is an issue. I'm going to start with vehicles and address the others in a bit, but it's certainly not the only topic to be addressed. When it comes to vehicle safety, the biggest take-home message of our No Hot Pets campaign is if your animals cannot go wherever you are going, it is best to leave them at home. And that can be hard for some people to hear because sometimes a good car ride is one of the best enrichment, practices you can do with your dog. A lot of them probably really love that adventure. They may look forward to it. You may not even be able to say the word car at home without someone getting really excited. But when it comes to the peak of the summer and the heat in the summer, if that animal cannot go into whatever store, whatever stop you're making throughout that process or at that drive, it is best to keep them at home. Those vehicles can get hot so quickly, and I always use the example of if you're driving with someone, you get to a store, you've had the air conditioning on the whole way there, you're almost kind of cold, and they say, do you want me to leave the car on for you? And you say, no, I'm good. They take the keys, they head in, and they've been gone for maybe a minute, and you're already opening the car door because it's gotten so hot so fast. It's the same with our pets. A few minutes can really, cause something unwanted that we are not aiming to do, but can happen so quickly when someone's not in there monitoring the temperature of the vehicle. People will ask about air conditioning, rolling down your windows. When it comes to windows and rolling down your windows are a great way to reduce the heat in the vehicle, but it does not ensure that it is a cool enough space for your animals. As well with air conditioning, number one, it could always malfunction, but that's very unlikely in the grand scheme of things. A big piece of it is you've probably seen online videos of dogs honking the horn, rolling down windows, locking and unlocking doors. They get bouncy, they get nervous when their owners have left the vehicle, and they can also bump off air conditioning very easy, just as easily as any other button in the vehicle. And the second the air conditioning is off, that is immediately now a closed vehicle that has no, cool air going into it. So the take-home message is that if you do not have pet-friendly stops along your way to leave your animal at home, or if you're traveling with a human companion, take turns. Someone stays with the animal, you go in, and you swap. That extra 5 minutes is worth it, and there's a reason why it's an annual campaign for us, because there's always someone who kind of still needs to hear that, and we want to make sure that our furry friends are safe when it comes to vehicle safety. Moving on to other heat topics. So when we're looking at being outdoors in their own yard, we want to make sure that they are provided with shade, with nice cold water, and that they're going out in short intervals. So the short intervals can be very tricky. A lot of animals love the outdoors, love to be out there, maybe love to sunbathe, but it's really important to keep them out there in short intervals to prevent, any sort of heat stroke, any sort of medical kind of beyond a panting and drooling, which is up on the slide here, that goes beyond that. So panting and drooling is usually one of our first signs that an animal is uncomfortable, but it doesn't mean that they're in any sort of life-threatening condition. It does mean that you should bring them in, cool them off, provide them with water. If you're out at the park, at least find some shade for them. But when it gets closer to unconsciousness, or unfortunately does reach that point, that is where prompt veterinary attention is vital. So one thing with heat stroke in animals is that is likely happening in the peak of the day, kind of in that hot part of the day. So your veterinary offices are likely open, sometimes with other animal emergencies, we're looking at after-hours clinics with veterinary offices, which can be a bit trickier to find locally. But one, not necessarily benefit, but one resource that we can lead on is if your animal does go to that point, that all your veterinary offices should be open, and that should be an accessible resource if needed. If your animal is kind of in that part of panting, drooling, showing signs of heat stroke, but not anywhere near a life-threatening situation, like I said, bringing them to a cool space, providing them with water, and wetting them with lukewarm or cool water. It's a natural instinct to give them like an ice bath of the coldest water you can find, but that shock to their body is not helpful. So making sure that that water that you're wetting them with is a lukewarm or cool temperature is a great resource to have and to know if you start to see those uncomfortable signs in your animals. So, other considerations. Number one is surfaces. So you've probably seen a lot on pavement temperatures. That's specifically walking your dog on like a black pavement that's hot. It's also the same for deck surfaces in your own backyard, especially if you have a darker wood or like a dark composite deck. I always say if you can't walk on it with bare feet, it's uncomfortable for your pets as well. So keeping that in mind, again, that goes back to having a short interval outside, maybe just holding back on walks in general. And that also plays in when you see those heat warnings come out this summer. It is relevant to your pets as well. So if they're saying that we shouldn't be out there, neither should your pets beyond their washroom breaks. So it is a great investment to find a few enrichment toys or even to just freeze some peanut butter in your freezer, something that's going to keep them busy but keep them indoors. Another great thing to keep in mind, my dog personally is crate trained. So when I leave the house, he goes into a crate and he is situated in a spot that stays kind of shaded or is away from the window. So that's another great reminder for anyone who has a crate trained animal that if they are by a window, if there's blinds, to make sure that they stay shut so that the direct sunlight is not going on them. And then when it comes to grooming, certain breeds need regular grooming. Making sure that we're staying up to date on that is very important to ensure they're comfortable this upcoming summer. So lastly, when it comes to taking action, this is a really important resource that I try to promote in the community quite often because a lot of people don't know this. So the Ontario SPCA used to be responsible for investigations in the community. So if there was a concern with animal welfare, we would be who you call. Now that is a PAWS responsibility. So that's the Provincial Animal Welfare Services. So a lot of people in the community still come to us, and that's where we now direct them to go. We focus on community education, food bank pet food distribution, and then of course our rehoming center, but we do not do that aspect of what we used to do. So PAWS is fully responsible for that. PAWS is for something of concern, but not a life-threatening emergency. So as I'm talking about, for example, vehicle safety with your animals, if you were to see an animal in a vehicle in distress this summer and it was a life-threatening situation, that is a call to your local police, not PAWS. If maybe there's something going on in your community you're concerned about and it's in regards to the welfare of an animal, that, and it's not necessarily that it needs to be addressed, within a few minutes in that moment, that's a call to PAWS. So that's a really great resource to have. You can just Google PAWS and the whole acronym and the phone number, everything will come up for you. A lot of people don't know that we no longer are responsible for that aspect. And no matter what, if you forget and call us, we will make sure that you get the information you need. But the biggest take home of all of this is PAWS is for any animal welfare concerns that you have this summer or any time of year. And if you see any of these heat related, life-threatening emergencies in the community, in the parking lot of somewhere, etc., that if you're looking to call emergency services, that is a local police issue. Okay, that's everything from me. Thank you very much.
Hi, thanks. Can everybody hear me okay? A little volume check. Okay. I tried to make things really easy for Chris and Sue. I put everything on 2 slides, so they are kind of busy, but I'm going to try to speak to each unique point individually as we go through here. So heat stroke does occur when the body's temperature Heat stroke occurs when body's temperature regulation fails, and it leading to a rapid rise in the core temperature of one's body. And that's usually defined as greater than 40 degrees Celsius or 104 Fahrenheit. It's considered a true medical emergency, and without treatment and or stopping it can lead to some severe end organ issues in your body. From a signs and symptoms perspective, that's that high temperature that you're going to be looking for in heat stroke, heat exhaustion. And the one key factor that's different from a heat stroke is you wind up with an altered mental status for an individual. So that's how you can really tell if something's different between heat stroke and heat exhaustion, is when somebody starts showing signs and symptoms of confusion, agitation, slurred speech, irritability, delirium, or you can get to the point where there's seizures and or somebody's in a coma. Usually it's characterized by hot, dry skin, but you can have some sweating that still occurs. There's some nausea and vomiting also associated with it, and usually a rapid heart rate and a rapid and shallow breathing. So if you think of it from our four-legged friends, it's similar. So somebody's trying to pant to kind of dissipate heat to move it away from their body. Talked a little bit already about the differences between stroke and exhaustion, but stroke is primarily characterized by the excess of sweating. You get some weakness, muscle cramping, dizziness, headache, some nausea, but your core body temperature doesn't go above 40 degrees Celsius. It can develop into heat exhaustion if left untreated, though. So from an immediate threat perspective, what you want to do is move the person away from that warm or hot environment. Try to, if they have an altered mental status, you'd want to call 911 immediately so that you can get paramedics and emergency services on their way. Attempt to begin some cooling procedures, so that's removing people's excessive clothing if they have that, some cold compresses or packs on the backs of your necks, maybe in your armpits or the groin area, to try to allow for some cooling to take place at that point in time. You wanted to continue to monitor the individual and continue cooling efforts until paramedics do arrive. On paramedic arrival, they'll notice it as an emergency and probably initiate prompt rapid transportation to the hospital at that point in time. There may be a few things the paramedics will have to do if it hasn't been done, but they'll start doing the same things that I've just described, where removing clothing, cooling things down, do some vital signs, so taking a blood pressure and heart rate and all of that stuff. Core temperature is what you're actually looking for. We're not going to be taking core temperature, and if you do tympanic or axillary temperatures, they're probably not going to be truly accurate because your skin and the air temperature is going to probably show a higher than normal reading in that situation. But core temperature is what we'd be looking for. So they'll also be looking for other medical conditions that may be developing. The big issue that people will need to worry about is organ failure, kidney failure, cardiac issues, and maybe some respiratory problems that could be associated with heat exhaustion as well. High-risk groups for this, the elderly will run into some issues, primarily because they have a reduced efficiency for thermal regulation in your body, so you can't control your temperature as well. There may be some medications that individuals are taking that also interact with your ability to thermal regulate your bodies. Or there could be some sensory impairments where people just don't feel the heat as much and they don't realize that they're getting overheated as quickly as they are. Same goes in the opposite end of the spectrum. Infants and small children, obviously some can't control the clothes they may have on or the fluid intake that they may be getting at that point in time. They also have a larger body surface area to mass ratio, so bigger heads on kids, bigger torsos on kids, smaller limbs and arms, so there's not the same ability to dissipate some of the heat that's associated with the kids. Also, people with chronic illnesses and or diseases, so if you have a compromised immune system or compromised systems to regulate your body, you're not going to be able to control your heat or your temperature as evenly as others can. Obviously, people who are participating in strenuous activities or physical activities are going to run into some issues with maintaining their body temperature. So people who are out for a run on a super hot day may need to take more frequent breaks or come into the shade a little bit. Individuals living with obesity or those with psychiatric or cognitive issues could have insulation issues where they can't dissipate that heat. Heat retention due to higher metabolic rate or heart or heat generations, or decrease awareness and judgment on their ability to understand when it's hot or when they need to come out of the heat. Medications can also affect your ability to control your own body temperature, so it's something to keep in mind as well. Hydration is an important aspect when you're out in the heat. Knowing when to take fluids and taking enough fluids and not waiting till you feel thirsty, especially in high temperatures. Monitoring the color of your urine as a good indicator of hydration, so the take home would be pale and clear is ideal. When it gets super concentrated, it is not a good thing. And from a fluid replenishment perspective, those that are involved in strenuous activities or doing a lot of sweating, there may be a need for some electrolyte replenishment, so an energy drink or something along those lines, but that's usually a later on thing. Water is probably the best for individuals in the heat. So kind of in summary, heat stroke is a critical condition. Heat exhaustion, heat stroke is a critical condition that necessitates immediate medical attention due to the potential for severe systemic damage. It's critical to distinguish this from heat exhaustion. For proper intervention, high-risk groups should be educated on prevention strategies, including adequate hydration and recognizing early signs and symptoms. So now I get to move on to my second most favorite topic today, and that's going to be some water safety tips and tricks. So unlike the dramatic portrayals that we often see on television where people are drowning, drowning can occur quickly and quietly. Individuals, especially children, might be unable to call for help because their focus is entirely on trying to breathe when they're in the water. So it's not something that we may notice quickly, so it's really important to have an eye out for people, and especially children, to notice and maybe pick up on some of the subtle signs and symptoms of people struggling in the water. Should be aware that a drowning person may appear to be bobbing in place or struggling to swim without making any noise at all. Children and impaired individuals would be those at most high risk of drowning. Young children, due to their curiosity and lack of swimming skills, can drown in shallow water such as bathtubs or pools. I think we all are quite well aware of that. Impaired individuals, whether due to alcohol, drugs, or medication conditions like epilepsy, are also increased risk due to compromised judgment and or physical capabilities. Prevention strategies include supervision, fencing around pools, and using life jackets. Now it's also, I'm going to maybe do a quick note on the difference between a life jacket and a PFD. So a personal flotation device, or a PFD, is something usually worn when somebody is engaged in an activity, whether it be canoeing or kayaking. It's usually a little bit more comfortable to wear, where a life jacket is something that's going to keep you above water and it's going to right you. So if you think of it, if you go into the water face first and you're unconscious, a life jacket should flip the person over so that their face is in the air, where a PFD won't allow that to happen. So just a quick think or take home on that. Water-related traumas can result from diving injuries, collisions with objects or other swimmers, or accidents involving watercraft, such as which can lead to secondary drowning situations. So in a boating incident or something along those lines, where somebody may be thrown from a boat, they could be rendered unconscious and left in the water, not breathing, and subsequent to a secondary drowning at that point in time. So one should always keep in mind, if you find somebody in the water after an accident of some type, there may be some secondary trauma associated with them being in that condition in the first place. Something that's really not thought of a lot of is hypothermia, but If you consider the temperature of the river right outside of us right now, it's probably in and around, and I'll use the old school side of things, but maybe 70 degrees, 65, 70 degrees. I don't know if it's warmed up much beyond that right now. That would translate into high teens, low 20s on the Celsius scale, I think. And a core body temperature is sitting at 37 degrees. Or 100 or 97 degrees Fahrenheit. So if you're in that cold water, your body temperature can easily drop quickly, and you can result in a setting of hypothermia. So something to just keep in the back of people's minds as people spend a lot of time in the water, or if they can't get out of the water for a long period of time, there could be a risk of that individual developing hypothermia. Some of the risk factors that I've put down for recreational drownings are just lack of supervision, alcohol consumption, lack of swimming skills, and non-use of life jackets while boating. Public messaging, I think, has been really good over the recent years about the importance of wearing PFDs, life jackets, when you're on the water. The same with consumption of alcohol on the water. All of those items can lead to not great situations. Non-fatal drownings, we used to refer to these as near drownings, but they are just as serious. Individuals who experience a non-fatal drowning incident may suffer from complications such as respiratory distress syndrome, brain damage, or oxygen deprivation from the secondary drowning in the water, from secondary drowning of water being in your lungs at that point in time. So water safety involves understanding that silent and often unpredictable nature of drownings, identifying some high-risk groups, and recognizing associated traumas and conditions like hypothermia. So hopefully I've not exceeded my time frames here, but thank you very much for allowing me to have a quick chat. And I forgot at the start, thanks Julie and Trish for inviting me for this. I know Julie mentioned that I'm the chief of the Leeds Grenville Paramedic Service, so we kind of cover the entirety of the United Counties of Leeds and Grenville, stretching from the Rideau River in the north to the St. Lawrence River in the south, and we go from essentially the 416 in the east to Highway 15 in the west, and all areas in between. Thank you very much.
All right. So now moving on to two interesting and really applicable topics is the sun as well as ticks. We heard about how ticks are impacting our animals. Now we can talk about how they're impacting us. So the first thing that I wanted to do is really ask a question to you guys is, who in the audience has yet this summer had a sunburn? If anyone. One. And you might be too shy to admit it, but it's okay. A couple. So a few. I guarantee by the end of the summer, a lot of us will unfortunately have gotten one. And that's the reality of it. And I think just working to prevent is key, because prevention is, as with a lot of things, is really important. So the real issue with the sun is that it produces ultraviolet radiation, and this radiation hits our skin and it interacts with it and causes changes. There's two different types of radiation, and you might hear the terms UVA and UVB. These are referring to those two types, and we talk about them because those are the ones that do cause changes to the skin. UVA is a little bit deeper penetrating to the skin, and it's going to cause changes like wrinkles, fine lines, aging, but it's not typically responsible for sunburn, although it does still contribute to it a little bit. Interestingly, some drugs can cause you to be more susceptible to the sun, and they do this by the mechanism of UVA radiation. So just an interesting caveat, but a lot of medications, and your pharmacist will be able to talk to you about which ones do, blood pressure medications, some anti-inflammatories, some antibiotics and antimicrobials. There's lots of different ones, and they do make you more likely to be impacted by the sun and feel the effects of it. There's also UVB radiation. UVB radiation is the one that typically does cause sunburn. It's a little more surface level penetrating to the skin, and it has good and bad to it because it's also primarily responsible for vitamin D synthesis, which is used to help absorb calcium, and it's an important vitamin that people can take. What's good to know though is that for vitamin D, your levels aren't going to be impacted by whether or not you use sunscreen, so it's really not an excuse not to use it. So moving on to the UV index. The UV index is commonly referred to in web weather advisories, and it's going to help indicate to you when you should start using sunscreen and when you should start maybe avoiding the sun altogether. Once it reaches a level of 3 or above, that's when you should start to think about using sunscreen. Once it reaches the level of 6 or above, that's when you can sort of start to think about avoiding the sun, keeping out of it, not going into it in direct sunlight. And then certainly once you get into the very high category of 8 and above, that means maybe staying indoors, not going outside, that sort of thing. How can we protect ourselves from the sun? Well, the best way to do that is by not going into it and not getting exposed, but also our sunscreens. So sunscreens are exactly like sunglasses for your eyes. They shield the skin, or they prevent burns from happening. There's different types. So mineral sunscreens are ones that aren't absorbed by the skin. They form a really nice clean barrier on it, and they reflect the sun rays off of the skin. These are really good because they're not really irritating, but they have a drawback of causing pimples. So if you're someone who's more acne prone, this type of sunscreen might not be for you. The other type is an organic or a chemical sunscreen. These are typically seen in most products, like copper tones. They are ones that are absorbed into the skin, and they react with the sun's rays and prevent it from causing damage. These are really nice because they're really thin, they're not very pore clogging, and they don't really cause pimples as much, but they can sometimes cause allergic reactions and be a little irritating to the skin. So there's pluses and minuses to both. As far as applying sunscreen, overall, it's best to do it before you go into the sun. So at least 15 minutes, 30 minutes before you go into the sun, that's when you should be applying it. And I like to think about something called the teaspoon rule to help you think about how much you really should be applying if you're doing it the textbook correct way. So that says that you should be using a teaspoon for your face and your head, a teaspoon for your arm, 2 teaspoons for your torso, and then 2 teaspoons per leg. So it's quite a lot of sunscreen, and most people don't apply the correct amount whenever we are applying it. So it's just something to keep in mind. It's a lot, but it is needed. And there are certainly some parts of the body that are more prone to getting burned, like the shoulders if you don't have a top on. So that's something to keep in mind as well. Maybe you want to pay more attention to those areas and put the right amount on in those versus other areas that might not see as much sunlight. As far as choosing a sunscreen, there are a couple things that I wanted to highlight to keep in mind. If you have an infant under the age of 6 months old, sunscreen use really is not recommended because the skin can be really thin, easily irritated, and so any of the chemicals or minerals in sunscreen can irritate that skin. So the best advice for this age category is to stay out of the sun altogether. In children less than 2 years old, opting more towards a mineral sunscreen is best because I mentioned earlier they're not as irritating, and the skin in this age group is growing, it's getting older, it's maturing, and so you do want to be a little bit more careful, but you can still use the sunscreen in that age group. As far as which sunscreen to get off the shelf, look for ones that are at least SPF 30. So that's the rating that shows how well a sunscreen protects you from the sun. At least 30 is recommended, and get one that is at both UVA and UVB labeled, because both types of UV radiation can cause issues with cancer, it can lead to aging. So both are really important to look for. So that was sunscreens. And now I'm going to ask another similar question about ticks. So who has had a tick bite so far? So even more than have had a sunburn, which is interesting. And if I would have asked that question a while ago, it probably wouldn't have been the same response, because with the changing weather and the rising temperatures, ticks are migrating north, and it's becoming more and more of a problem. So tick season is actually anytime from snow melt to snow thaw. Anytime it's above 0 is when a tick can be potentially there. For most people, a tick bite doesn't actually cause pain. You don't actually feel it when it bites you. But what happens after the tick bite is something that most people do get, and it's a hypersensitivity reaction, which is the same thing as a response to a mosquito bite. It's your body's natural way of saying, hey, something's here, what's going on, and you get a response and it shows. So this is gonna present with a little bit of swelling. It's gonna be a little bit itchy. There's gonna be some inflammation in the area or redness, but it's gonna be small. It's less than 5 centimeters, and it's also not expanding. Also, it shows up early, so within 24 hours of the tick bite is when you start to see that reaction. So most people do experience this when they first get a tick bite, but it's nothing to be alarmed about. It's just your reaction to the bite itself. Moving on to different areas in the country that are more likely to have the problematic part of a tick bite, which is Lyme disease. So different areas have different prevalences of the bacteria that causes Lyme. So in these regions that are on the map, at least 30% of the tick population has the bacteria that causes Lyme disease. So this is the Maritimes, Nova Scotia, New Brunswick, PEI, a lot of southern Ontario, southern Manitoba, and then southern British Columbia. So if you're traveling in these areas, that's where you want to be more, have tick prevention, not concepts, strategies to deal with the ticks. Different types of ticks. So the main ones that we want to be concerned about that carry the bacteria that causes Lyme are these ones, the black-legged tick. And these are 2 different types. The one that you see here in Ontario is the one on the left, and then the one on the right is the one that you see out west. Some of the earlier signs of Lyme disease. So these are a little bit different from that reaction that I talked about when you first get a bite from a tick. Most individuals do get a rash that appears about 3 days after the tick bite. And not all individuals do get it, and it presents differently in different people. So a lot of us might have heard about the bullseye rash that's associated with Lyme disease. That's this, but not everyone does get a bullseye rash. Some people get a different type of rash. It just looks a little different. And not everyone gets a rash in the first place either. So, but a lot of people do. Where you can sort of think about how it differs and start to think about, is it Lyme or is it not, is how it presents. So the size of it is typically larger than the reaction I described earlier. It's typically larger than 5 centimeters. It can be as big as 30 centimeters. So if you think about like a little ruler, it can be pretty big. It's typically expanding, so if you keep track of what it looks like over time, it's going to change. And then also when it started, so I talked about it's at least 3 days after the bite. Some people do get flu-like symptoms as well. How can we prevent these bites? Because this is the main thing that I want you to take away from this presentation, in addition to the sunscreen use, is prevention. Because although pharmacists are able to help and other healthcare providers, your physician can prescribe medication to prevent Lyme disease. If you do that all the time, it's going to be problematic, it's going to be inconvenient, and it's hard on your body too. So emphasizing these is really important. So the best thing to do are these 3. Insect repellents, I'll talk about. Clothing is also another important one. So light colored clothing, because ticks are typically dark, so they will be able to be spotted on light colored clothing. Tucking your pants into your socks so that they don't have to climb up as far to reach skin. is also a good measure. And then I think personally the best one to do are daily tick checks. When I worked at a park, I did a tick check every day when I got home from work. And the thing with ticks is if you can get them off early enough, then there's a lot less worry with it. There's almost no chance of getting Lyme disease if you get it off within a day. So if you do a tick check every day and you're outside, then that's your ticket, right? It might just mean some awkward contortioning in the mirror to get to the areas that ticks like to go to, because they like warm spots. So the back of your neck, the armpits, the groin, also on the ankles is really common. So knowing the areas where ticks are commonly seen is another good strategy too. So you can prioritize where you're looking when you do your tick checks. Showering is also good because it can wash the ticks off. So usually when they first bite, they are easily removable, and the water from the shower can just wash them off. So repellents. Some types of ingredients to look for in repellents are two main ones. There's more than just these two, but these two are the ones that work the best. These are DEET and icaridin. Both of them are effective at preventing ticks and mosquitoes and insects. There are subtle differences between them though. So DEET has some more variability in how long it lasts. It can last from 3 hours to 8 hours, depending on how strong the product you're using is. Whereas icaridin, most of the commercially available products will last you the 8 hours, like the longer amount of time. Also, the benefit of icaridin is that it's less irritating and allergenic to the skin. So for those reasons, a lot of healthcare professionals, at least in the recommendations and the guidelines, suggest using icaridin over DEET, but both are great agents to look for. Generally speaking, applying it, avoid contact with your eyes and your mouth. You can apply it to your hands before you put it on your face, so you're avoiding like spraying it right in your face. And then for kids too, the same rules apply as sunscreen. So if it's less than 6, if it's an infant less than 6 months, then avoid using the insect repellent and opt for keeping them away from where the bugs might be. So finally, I wanted to talk about something that pharmacists can help with. Of course, at any time, you can go and talk to the pharmacist about ticks. This is probably the #1 thing that I'm seeing minor ailments prescriptions for right now is ticks, at least at PharmaSave, is the assessment of whether or not you need the prophylactic or preventative treatment for Lyme disease. So if you go to the pharmacist, they're able to assess how you're presenting, what the rash might look like if there is one, also take in other information that might help them make their decision, and if it's necessary, then they're able to prescribe an antibiotic that can help clear any bacteria that might have gotten into the bloodstream or into the body from the tick. It's important though to emphasize like the prevention measures that I mentioned earlier, because that's going to be really key. But this is also an option in case that fails. So just another tool in our toolbox against Lyme disease. And then some 2 other points that I wanted to touch on briefly are pregnant individuals. So in this age group, there are some concerns, and anytime this patient does come to us or any healthcare provider, you do want to talk about the potential or theoretical risks to the baby. So issues with bone formation and discoloration of the teeth are 2 things that might happen with doxycycline. But it's only 1 dose, and for that reason, a lot of the guidelines suggest that it is best to do this for someone who's pregnant. For less than 8-year-old children, the effectiveness of the medication might not be as strong, but it's still something that does work, but it's just another thing to keep in mind. So yeah, that was all that I had to go over today, so thanks for listening. Yeah. We'll take some questions now, or yeah, go ahead. Yeah. if your family doctor or other healthcare professional you can't get in to see them, I would suggest going to the pharmacist first, because it's something that we can easily do and easily help with. So I would say steer towards the pharmacist, but I'm of course biased because I will be one soon. But any healthcare provider will be able to give you good information with it. Yeah.
Sorry, is that on? We're going to move the tables, and we're going to have some questions from the audience. We have a few prepared questions. If you want to take a couple of minutes, if you don't want to ask it, we will give you the microphone if you want to ask it. If not, then you can write it on your cue card, and one of our staff members here will pick it up from you. So just give us 2 minutes. We'll move the tables, and then we'll do a quick fireside chat and answer any questions you might have. Okay, we're going to start the questions. I've actually got one from the audience. It's a sunscreen question, so anybody who can answer it, please do. My 2-year-old grandson struggles with eczema. He wears SPF 50, long sleeve swimwear, and brimmed hat, but his legs and face are still exposed. Again, he's 2 years old, and they have all the swimwear and the hat. What sunscreen would you recommend?
That's a great question, and he's right on the border of when you would start to use or think about using the chemical sunscreens. Given that there is a history of eczema, I would think more, or I would gravitate in my recommendation more towards the mineral sunscreens. Having said that, though, on the face, those yeah, I mean, usually, like, on the face, chemical sunscreens are beneficial because of they're less likely to cause pimples and acne, but I think also the mineral ones could be used in this age group as well, and so I would probably say that one is best.
Does anybody have any questions from the audience? Okay. Hold on one sec. We'll just...
Hard because you can't really tell how much you've put on. If you do use a spray, I would do it in an area where there's like no wind. Because the problem with sprays is, like, you miss most of the skin whenever you do apply it. So I don't like sprays for that reason, but they are super convenient. I give them that. But it's just hard to tell, like, how much you're putting on, right? But I don't know if Leslie...
A big thing with sprays, too, is remembering to rub it in after you spray it. You just can't spray the spot. You actually have to rub the sunscreen in. And just with any of them, remembering to reapply. If you're swimming, sweating, it may say it lasts for 8 hours, but if you're perspiring a lot, if you're in and out of the pool or at the beach, you need to reapply to make sure that you're protected.
Another sunscreen question. You see a lot of clothing out nowadays with SPF in. Is it effective versus just normal clothing? Because I'm assuming normal clothing protects you a little bit as well from sun.
I don't really know about that. I know that Tilly stuff and some of the other brands do claim to give you more protection. But I think basically just covering yourself does help.
So the clothing in general has to do with just the rating of
how thick or sheer like how sheer or not sheer the fabric is, and also the extent to which the fabric is able to reflect light, especially UV light off. So it's not to say that so quote normal clothing will do the same, but you wouldn't necessarily have the same sort of assurance that that whatever it is that you're wearing has been rated to the same as the number. So I believe it's not called SPF. I believe it's called SPU. In any case, they're not equivalent. So it's not to say that replacing so clothing is always going to be a useful way to prevent sun damage. Not all clothing is going to be equal. As you might imagine, clothing with holes, clothing that is more sheer, is going to be less effective. In general, the ratings are sort of a guide to help you understand the level of protection of that clothing, but it's not to say that it's got some secret magic technology that you don't get in normal clothing.
I have a couple of questions. Water test kits, can we still get those at the health unit?
Yes, please come. We have on our website, the health unit's website has we have a web page listing where we have the water bacterial test kits that you can pick up. Most of the health unit locations has that, and then we have some out in the community as well. Just as a hot tip as well, not always is the health unit open, and so there are some days where we're closed, and then and also some days where the drop-off is closed because we have to get it to the lab by a certain time period, and so all of that information will be on our website.
And the second, if you're in a situation where you can't wash your hands, are the hand sanitizer okay?
Yeah, so the rule of thumb for hand sanitizer is unsoiled hands. So if there's visible stuff on your hand, if it's visibly discolored, then so hand sanitizer is not going to remove the dirty stuff from your hand. It just inactivates the pathogens that are there. But if the pathogen is inside the stuff that's contaminated, like if it's dirty on your hand and the pathogen is there, the hand sanitizer can't consistently penetrate into that, and so it's not going to be. So if you have sort of generally sort of not visibly soiled hands, then hand sanitizer can be effective. As a note as well, hand sanitizer can have different strengths. Usually they're alcohol-based hand sanitizers. That's what we recommend as well. Alcohol-based hand sanitizers, we do recommend you look at the strength to see if it's at least 60 or 70% alcohol, because there are certain pathogens, for example, some viruses are not actually fully inactivated. Norovirus is the classic example. That's not fully inactivated if your alcohol hand sanitizer concentration is too low.
The nurse practitioner who checked me out, she said, that bullseye is so large, so itchy, so red. It looks like 5 days ago you got the bite, so I'm going to treat you for Lyme. So with Leslie's help, I think we went through 3 antibiotics because I was allergic to all of them. So I took the 4th test and then sent me for blood work, and then a month later, more blood work, and I was okay. So that is a route that you can also go if you end up with a bullseye. She said I was really lucky I had the bullseye because a lot of people don't get it. So that's what alerted me to.
no questions from the audience. I had a couple here. So there was and maybe for Caitlin, there was or Dr. Lee, a case in the States where there was a woman who died of inhaling mice droppings. So is that something we need to worry about here?
That was a yes of sort of memory, not a yes that we need to. So I'll explain. So I don't know the specific case, but I'm guessing it would be hantavirus because that is the most common respiratory related pathogen for mouse dropping. So hantavirus is a virus that infects rodents and can be found in rodents across Canada. There have been cases of hantavirus, and the disease that it causes, the most severe form of the disease is a pulmonary disease, and so it's the stuff that you breathe in, and then the virus gets into your lungs, and it can cause quite a serious illness. It can be fatal. There are rodents in Canada that have been identified to have hantavirus, and there have been cases of hantavirus pulmonary syndrome in Canada. I do not believe there have been any in Ontario. There have not been any in Ontario since we have started testing and tracking hantavirus in Ontario, which I believe was in the 90s, but don't quote me. But we know that there have been cases in other parts of Canada. There is no routine testing for rodents for hantavirus. So I don't know if there rodents in Ontario have hantavirus. I just know that humans in Ontario don't get hantavirus. And I also know that rodents, travel, and we do have hantavirus in other parts of Canada. I would say overall the risk is low. It's again something that if you're picking up, so where I get mice every once in a while, so picking up droppings or cleaning where the there may be like mice nests or mice droppings or whatever the case may be. Again, using gloves, washing your hands, not aerosolizing whatever it is that you're cleaning, and then if you have access to a mask, it may be helpful, but it may not be critical, because if you're not aerosolizing things, if you're not sort of like bringing it up into the air, then the risk really is minimal. If it's a big sort of nest, then you can consider a well-fitted mask, especially a respirator, which can be helpful, but I would say in principle, there is not studies that I'm aware of that, because hantavirus is rare, that gives you sort of clear scientific evidence as to the utility of masking.
I actually have a friend whose sister passed away, probably from this area locally about 5 or 6 years ago, and there was something that she was doing out in the yard that she lifted up wood and then inhaled something. I don't know what it was, but she ended up having really bad flu symptoms. Lasted for days, and then they finally found her, but they ended up having to take her to Toronto, and it was in her lungs, and she ended up passing away about 2 weeks later. So I don't know if it was that or not, but it was something that, again, doing yard work, if she had had a mask on or something like that, again, it's inhaling whatever it was toxic, obviously, to her.
Question for Caitlin. We heard that many medications, sunscreen, not good for kids under 6 months. What about tick and flea medication for kittens and puppies?
When you go to your veterinary appointment, specifically when you're going to your first few appointments, so they're typically called like the little first 3 puppy appointments. They're doing their first 3 rounds of kind of, that's where you can choose to have some, whether it's optional vaccinations, but there's also the kind of more of your mandatory that you're doing 3 rounds of with your puppies or kittens. They're also going to be weighing your animal. So usually, especially with bigger breeds, that first year of life, you are going to be going in and out and doing regular weigh-ins, and they will accurately change your flea and tick medication to be the proper dosage. So I got a puppy in January. He is a little beagle. His name's Pinocchio, and we took him to his first appointment, and his dosage was very small. His next two were spaced out between months. So usually, for example, his flea and tick, some are different, but his is a monthly. So the first kind of 4 months of his life, we were going in monthly to weigh him and get the proper dosage. And then the next checkup with him, it was, okay, he's kind of in this weight range where we can give you the next 3 months. So that's what we're wrapping up now. Because he's a smaller breed, with being a beagle, he's probably reached around his maximum weight. And his next checkup, where we go to get him just weighed, it's not even a full wellness check. You're simply going in, weighing them on the scale that's kind of in the front lobby, and then paying for your flea and tick medication. This next one, because he's kind of in his full grown stage now, being a smaller breed, will likely be kind of the next few months again. Bigger breeds, it's going to be a bit more of, it can be frustrating if you're going in every month and having to get them weighed, but it's important that they're getting the proper dosage. So yes, early on in life, you're probably going to be going in and out and getting them weighed more often, depending on their breed. Once they've hit kind of their max capacity, give or take extra treats, they will be given their dosage for a longer period of time, and you'll be able to purchase multiple of their tablets or their back liquid, depending on what application it is, for multiple months going forward.
Great, thank you. And one more question for Jeff, just because we're curious. What are the most common calls that EMS would get during the summertime?
Great question, Julia. I think that we do get a lot of heat-related issues. I think overexertion, and that can lead to some secondary cardiac and/or respiratory problems. We don't get a lot of calls for really bad sunburns or anything along those lines. Those should be coming in on their own to the hospital, but it's usually a secondary injury from heat exposure in some way, shape, or form. So it's got a heart involvement or a breathing component to that.
Great, thank you. And then maybe I'll just leave you with one little piece of advice from my years of working in Emerge is be very, very careful of fish hooks. The number of people that come in with fish hooks, because those barbs are really, really hard to get out. And Dr. Lee and I were talking before, we've both worked in Emerge, where we actually had pegboards that we kept all the fish hooks that we took out of people because there were so many of them. And I mean, in all seriousness, like we took some out of pretty close to the eye too. So just to be really careful. And then there's also the risk of infection, right, when you're trying to pull out these hooks, depending where they've been. So that will be, and yes, get your tetanus if you have a fish hook. So that will be my piece of advice I'll leave you with. So I think that is time. So I'm going to hand.
Yeah. Another thing whenever you're traveling, especially car trips and that, is to have a well-stocked first aid kit with you. Maybe some antihistamines in it in case of bad, like you get into trouble with bee stings or that type of thing. Some bandages, peroxide, polysporin. Your basic stuff just to have on hand. Maybe even one of the instant ice packs that you can snap if you get a sprain or strain, that type of injury. So just another helpful tip for safety.
Thank you very much. Thank you to our panel. You've been amazing. I hope each of you took one or two real tidbits away that you didn't know that will be helpful for you to have a safe summer. That's obviously very, very important. We always, if you have questions, you can call the office and we'll get some professional at the hospital to answer your question for you as it relates to some of these topics as well. We've given you a survey. If you wouldn't mind taking just a couple of minutes to actually fill it out. One of the important things we want to hear from you is to what do you want to hear about? Do you want to hear about concussions? Do you want to hear about mental health? What are those kind of things that we could have another session on that's going to be really helpful to you or your family situation or whatever's going to work. So please take just a minute to fill that out. we do have a little thank you gift token that Emily's going to give to our speakers. And if we could have maybe one more round of applause for all of them who gave their time tonight, that would be great. Thank you. And thank you all for coming. Our next one is actually going to be in September. And it's Wednesday, right, Chris? The 24th? The 24th of September. So stay tuned for that. We'll let you know if you want to sign up for our newsletter. We always have it in our newsletter and what's coming up in our social media properties. So again, thank you very much for coming tonight.